Good day, viewers, and welcome to another exciting edition of Presidential Talk. I'm your host, Juan Mendieta, where this program goes to locations throughout the college that are making news and impacting the community to bring you an update on things happening at Miami Dade College on MDC-TV. And today we're at one of my favorite locations at Miami Dade College, the medical campus of Miami Dade College in the heart of the hospital district of Miami. And we are in the simulation lab here at the medical campus where the latest technology is training the next generation of health professionals. We're joined by a familiar face, the recently, well, I don't know if I could keep saying recently, but the president of the medical campus, much deserved, Dr. Mark Everett. Welcome.
Thank you, Juan. Yeah, going on a year now.
Excellent.
Absolutely.
And we're also joined by the Dean of Health Sciences here at the medical campus, Dr. Ken Lee. Dr. Lee, thanks for joining us.
Thank you.
I think like we always do in this program, it's important for new viewers and old viewers as well to get an update on the campus. I think it's good to get a snapshot of the cross-section of what this campus offers and really what it means to the community.
Absolutely. So the medical campus, you called one of your favorites. This is definitely one of our favorites as well. The medical campus is such a gem to the college overall. It is in the health district of Miami. It is adjacent to Bascom-Palmer, University of Miami, Jackson Health System. And it's such a jewel for us. We have over 23 different programs operating out of this particular campus. We have some extensions over at the Homestead campus and virtual college, of course, but the primary functions are out of this particular campus. The 23 programs range from college credit certificates to an AS in various programs to also two bachelor programs. We have the BAS in Health Sciences with the Physician Assistant Studies option, as well as the RN to BSN program. So vast number of programs that cover the gamut. So if you picture a hospital, for example, you can name any floor. So from the ancillary services in imaging, for example, we have radiology, nuclear medicine, to the emergency room. So we have EMS techs, we have first responders, paramedics, et cetera. Then of course our nursing school, one of the largest in the nation, very successful program, and that's something that we want to highlight today as well. All of our programs, high demand, high placement, high retention, fantastic success. So our students are doing quite well in all of these programs.
Again, an incredible depth and breadth. Dr. Lee, a game I play with my kids when I take them to the doctor or go anywhere related to health, I ask people where they went to school, and every single time I'll come across at least half of those people, if not more, who are graduates of the medical campus.
Well, I myself am a graduate of medical campus also. I did a little bit later in life after I became a chairperson over the School of Emergency Medical Services, that I actually went back in as an undercover student, undercover boss, and did the EMT program itself. So my background itself is a doctorate degree in physical therapy. I became a physical therapist assistant first, just like we have at the medical campus here, which was my track to lead me to become a physical therapist. But here at the medical campus, we have a wide variety of programs. We have a lot of career pathways that are set within our programs. So as Dr. Everett said, that some of our students will start with a certificate program, which will lead them into their Associate of Science, and then along the pathway towards their bachelor's degrees and other degrees as they progress in their skills and where their wants are in their career.
And at the heart of the quality here, Dr. Everett, is really the faculty and accreditation. And before we get to some accreditation news, tell me about the kind of faculty that we employ here at this campus.
Tremendous faculty, dedicated faculty, skilled faculty. Student support is unheard of. Our faculty are there every mile with the student, in conjunction with the student, helping support that student through their program, helping to identify some of the weaknesses and challenges that they may have, and helping them to overcome those challenges. And I think that goes throughout the entire campus. The student support infrastructure here is unparalleled across the college. We have so many things in place here for our students, and our faculty lead the way. I mean, without our faculty, we would not have our programs. They are such well respected in the community as well. A lot of them are still practicing clinicians in their own right. So they lead the way for our college, for our students, and also for medical campus.
So probably beyond all the other campuses, and they do a good job, but the mentorship, the support provided to students here by the faculty is probably unlike any other.
Absolutely. You're going to hear from a couple faculty later on today, and it is a pleasure to work with these faculty as well, and they have such great ideas. They're visionaries. They're leaders, and I can't say enough about their skills.
And as people consider schools and enter studies, besides the technology and the faculty, one of the key things they always have to look at is accreditation. And unlike, again, I keep saying unlike the other campuses, this specific campus is subject to very stringent accreditation beyond SACS and some of the other accreditations at the college. Why don't you gentlemen tell us about the latest in accreditation news for this campus?
Well, our latest in accreditation news is that all of our programs that have accreditation standards, they are accredited, and our students are well received, and nationally that brings recognition. The accreditation standard itself means that we've obtained the excellence of that profession. So for instance, in our physical therapy assistant program, we have an accreditation through CAPTE. Through our physician assistance program, we have an accreditation also through the ARC-PA that has a different accreditation standard. So within each program, respiratory and all the programs we have, there are certain standards that are within that look at what we teach, what the profession dictates is the curriculum, so they can come inside and to look at our books, to look at everything that we expose to them on their site visits to show that not only are we passing our students and retaining them at high rates, but also the content and the quality of the teaching itself. Are we well funded? And these are the things that here at Miami Dade College, and I could say from the 20 years I've been here, we've always maintained, and we've been excellent at achieving those goals. So as we look at our students when they leave us with accreditation standards, they're marketable, they're employable, they're ready to go into the workplace. Their degree actually means something because it has that extra seal of accreditation that stands behind it, which sets it apart from programs or other schools that may not have the accreditation standards. So that we know here at Miami Dade College that we put forth the effort, such as Dr. Everett mentioned with our faculty and being credentialed professionals, that they're able to come back and give that student that lifelong experience of what did it take to become a physician assistant? What did it take to be able to teach that and show that in the care of your patients, but then to go back to that student and magnify that in the lecture room or in the laboratory experience, that with our accreditation standards, we know that we offer some of the best education in the country, if not the best.
What I can add to that is we have, as I mentioned before, about 23 different programs, 19 of which have accreditation, specialized accreditation, from about 14 different accrediting bodies. And what that means overall is that we are submitting what we call a self-study on a regular basis for the most of our programs, which is an exercise by faculty, led by faculty, that literally analyze every aspect of our programs. And there are assurances that we need to offer to our accrediting bodies that we're meeting and exceeding our standards, which is very important. Much like in healthcare, most organizations today for CMS funding, Centers for Medicare and Medicaid funding purposes, they are part of the JCO process, Joint Commissions on Accreditation for Healthcare Organizations. And much like hospitals have to abide by various standards, so do we. And we oftentimes, if not 100% of the time, exceed those standards.
Well, that's great news. I mean, it seems to me in a nutshell that accreditation is an affirmation of excellence at this campus. And we're running out of time here in the first segment. It always flies. But we're going to continue talking about the excellence and the service at the Medical Center campus here at Miami-Dade College. We're going to be talking about faculty and student research. We're going to be talking about the important health fair coming up, and many other things. You don't want to miss it. We'll be right back. Thanks for joining us.
3, 2.
Be focused. Be original. Be a trendsetter. Be an explorer. Be the solution. Be visionary. Be a hero. Be the answer. Be the best. Be you. Be MDC.
Friends and viewers, welcome back to another exciting episode of Presidential Talk, where we are on location at the medical campus of Miami-Dade College in the Patient Simulation Lab, and we're joined again by Dr. Mark Everett. But on this segment, we're also joined by two members of the faculty of the Benjamin Leon School of Nursing, Professor Ann Graziotti and also Professor Billy Valdez. Thanks so much for joining us. And Professor Valdez, I'd like to begin with you. We talked about overall excellence in the first segment, but teaching excellence, student excellence, those are two things that really ring true at this campus. Tell us what that means to you.
Well, from the perspective of a professor in the plight of leadership, addressing, obviously a very not so specific with disciplines, but rather with leadership qualities. There are three components that we think are important when it comes to healthcare delivery, and obviously Miami-Dade taking contributions in leadership there. One is academic excellence. The second component is professional practice. And the third component, and a very important component, is that addresses patient and family-centered care, is healthcare services rendered. We want to have a very even and balanced set of professionals who are able to work within primary health. That would be prevention, so important these days. Secondly, secondary health care, diagnostics and screening, and obviously prevention for more serious problems. And the more traditional one that people are used to is healthcare professionals in hospitals, acute care settings. And what we do with our students here is try to embed a culture of safety. This year, American Nurses Association has put out a statement in building a culture of safety. Well, we've been doing that here at Miami Dade College with many of our education approaches, whether it's simulation and whether it's research and evidence-based practice in many of the literature reviews and problem-oriented specific PICO projects that we do here with our students, and where faculty and students get to work in some of these initiatives that improve practice and outcomes for patients, and obviously the wonderful work or my colleague here, Professor Ann Graciotti and Professor Horta, who work in the community addressing two very important components, which is prevention and family wellness.
And Professor Graciotti, tell us about those two components.
Sure. So I feel like we have a very great best kept secret with our RN to BSN program, because the students that we're working with are already licensed registered nurses. So we kind of have a jump on providing services in the community. One of my fellow faculty, Professor Orta, and I a few years ago approached Citrus Health Network in order to set our students up to do their clinical rotations with a population of underserved patients at Citrus Health Network. And they welcomed us with open arms. It was a wonderful partnership. We have since expanded to Carrefour Supportive Housing down in Homestead, and they also have welcomed us. We work with families who had formerly been homeless and have many, many health needs. So our nurses are on site in both of those facilities, providing education and screening, helping with referrals, helping with follow-up, and it's a win-win situation for our students, for the community, and for faculty.
If I can add to that as well, the benefit to our students is tremendous. The experience they receive at Verde Gardens, for example, is also tremendous, and this gets back to what we do for a living. Not only are we educating our students to a fantastic success rate, they are employable, they have skills like no other nursing program would offer, and our faculty are leading the way once again, and it does not get any better than this.
And Dr. Valdez, how do we accomplish? Is this something that happens spontaneously? Tell us about the work that goes into this.
Well, it takes a whole component of teamwork, and one of the things, that's a great question, because as I'm thinking here, listening to my colleagues and our president speak, we also have a component that is interprofessional, and the success these days is about all types of healthcare professionals working together in collaborative practice so that we can build a culture of safety in practice. It's also about academic excellence. One of the things we've done here is incorporate the model of QSIN, which is a Quality and Safety Education Institute for Nurses, that addresses three important components. One is knowledge. We definitely need healthcare professionals to have a lot of knowledge in practice. Skills are very important because we must be very safe in our practice. And then also the very important component, which is attitude. Their abilities to communicate among themselves in the team so we can really reach the goal of really developing a community of safety, and in addition to that, a lot of satisfaction. We want to produce healthcare professionals that are going to be able to lead in practice, and in some of them, if they're interested in more of the management roles, that they will be able to be very effective in those also.
I'm sure. And speaking of communities, communities of interest is something that you've also tried to implement here. Tell us about that project and how we're really trying to bring together this entire health community.
Absolutely. So community of interest is simply reaching out to our partners, our stakeholders, our students, our faculty, our administrative staff, staff in general, to build a culture whereby students are actively engaged, the partners are engaged, And sometimes it's transparent to them. So maybe it includes a speaker series. Maybe it includes reaching out to disciplines across the other campuses, for example, that may not be on the medical side of the house, such as business and leadership. But it's really creating this culture that really helps to encourage students, that benefits the students to the best degree possible. The community of interest really helps to solidify our partnerships as well. They belong to the healthcare community, and that's what we're trying to reach. Speaking of our partners, we have over 800 clinical affiliates throughout Miami-Dade in particular, which is an amazing accomplishment on its own. And again, a lot of those partnerships are developed through our faculty contacts as they are practicing clinicians or prior clinicians, but also academics.
And Professor, I see some students actually in the background right now doing some rounds with our simulation. They're taking vitals. What happens in this room? I have to ask.
Well, this is a very dynamic room. You can, we have all of the health professions can take advantage of the simulation lab here. Personally, for me, I had a wonderful experience a few years doing simulation, setting up the room like a living room in a home, like a bedroom in a home, to do community health simulations. So we have everything from the very critical hospital ICU facilities here to what a student may run up against if they're doing a home visit. So it's a very dynamic community in this simulation lab.
And this again, Dr. Everett, means that our students are going to be completely ready. This simulation practice, clinical rotations, not only in this community but even abroad that this campus does, really leads to a student that is workforce ready.
Absolutely. If you run into one of our students at any of the hospitals that are local, you will know first and foremost that they were trained here, and you will also hear about the respect that our stakeholders have about our students. Incredible respect for the skill sets that our students depart our campus with.
Well, Professor Graziotti, thanks for joining us on this segment. Dr. Valdez as well. We're out of time. Time flies on this show. So many good things to talk about, but that means we'll be back and discuss more in the future. Thanks for joining us. And we have one more segment coming up on this exciting episode of Presidential Talk. You don't want to miss it.
Be creative. Be a hero. Be the solution. Be connected. Be innovative. Be global. Be successful. Be you. Be MDC. Be Miami Dade College.
Friends and viewers, welcome to this final segment of Presidential Talk at the medical campus of Miami Dade College. A very exciting show where we're covering a lot of ground. And on this segment, we're going to talk about some specialized projects, also some of the community-focused and community-facing programs that this campus has to offer. We again have Dr. Mark Everett joining us. And we also have Ms. Carlene Webb joining us for this segment. She's the project director for the ESPER program. Welcome, Carlene.
Thank you so much for having me.
And why don't we begin talking about the ESPER program so our viewers can know what it is?
Sure. SBEC stands for Screening, Brief Intervention, and Referral to Treatment. It is a grant-funded program sponsored by SAMHSA, and we're in the second year of our grant, and so we're very excited. So far, we have trained about 10 MDC faculty members, 257 MDC students, and almost 100 healthcare professionals within the community. And so with the training program, we're trying to screen anybody that has substance abuse issues to make sure that they get into some kind of treatment or even give brief intervention before they get to the point where they're so addicted and it becomes very problematic for them.
It's interesting. Just earlier today, I was looking at a major story that the Herald did about the new heroin problem with this heroin variety, I guess, which is 1,000 times more potent. Yeah. But they talk about the problem being 2 blocks from this campus in the Overtown neighborhood. They actually plotted on the Dade County map where all the overdose deaths have taken place in the last couple of years, and you'll find them all pretty much isolated near this campus. So very timely, obviously, Dr. Everett, and
Yes.
this campus providing those services.
Absolutely. So this, you know, Carlene mentioned the SAMHSA organization, which is the Substance Abuse and Mental Health Services Administration, a federal agency that actually funded this particular project, which allows us to offer a training program in SBIRT at free of charge to our students, which is fantastic. And the reason our faculty are going through it so they can integrate it within their own programs, which is also a major benefit to our students. So not only are our students graduating with their associates in science or baccalaureate, but they also have the skills necessary for proper interviewing techniques, and further exemplifies the need for proper communication and interviewing skills.
Well, communication skills, business skills are needed for anybody, irrespective of the degree or program one studying. Whether a physician, a nurse, or other healthcare professional, you need to be able to communicate, you need to be able to plan strategically. And also in this community, cultural sensitivity. We serve a very diverse community. How important is cultural sensitivity training here at the medical campus?
It's absolutely crucial for any of our programs and any of our students, our faculty, our staff included. We have a couple other programs that I want to mention in reference to community health worker as well. Community health worker is another program funded through the federal agency called HIALEAH, Health Services Administration. And in essence, cultural sensitivity is a major component of that training program. These community health workers start with just a big heart that want to make a difference in their community by disseminating bits of information, whether it's about diabetes or heart disease or cardiovascular disease, obesity, you name it. And so it takes it to a different level. It gives them a little bit of formal training. It starts building a pathway to a career. And now what we're seeing with the community health workers, they're being utilized more than ever before. And I think we'll see that continue. So whether it's the health department, whether it's Jackson or Baptist through Baptist Congregational Health or Citrus Health, they're now starting to employ community health workers at a great rate. So we're happy about that particular program. Also free of charge to students that want to participate.
And I also had a line in my notes here really about the future of this campus and the future of healthcare education.
Yes.
Tell us a little bit about that.
It's an amazing opportunity for us. So in the, I'd say recent 18 months or so, we were fortunate enough to receive funding from the college to actually bring on board a 132,000 square foot facility, which will be centered on this particular campus. We call it Building 3. It will house one of the largest nursing skills lab in town. It will take this simulation center to a new level never seen before. We're going to basically triple in size of what we have now. There are some rules that have been changing at the nursing board level to allow for additional clinical practice in a simulation center. So we'll be taking advantage of that as well. We'll have a brand new conference center. We'll have breakout rooms, so we'll be able to have various agencies participate and host events here. So, but the most important aspect is for our students. The learning environment is changing. We know our students are now learning in different ways that you and I probably could not even imagine back when we were going to school. And so we're keeping up to date and current with the most recent technologies, the most recent teaching strategies in the classroom. And we're hoping to even gain more momentum in that regard by giving professional development to our faculty, bringing on new technologies in the SIM Center. So we'll be up to speed in every which way, shape, or form.
And I mentioned at the outset of this segment that we're going to talk a little bit about the community-facing programs that this campus offers. We're going to close off on the health fair, which is coming up in partnership with the Inter-American campus. But you have some clinics that provide incredible services to this community, and I just wanted to touch on that before we get to the health fair.
Absolutely. So we have our dental hygiene program here that is a very strong program, very successful program with about 100 students at any one given time. Our students actually run a clinic here for the community. Last year we served in excess of 1,500 patients. That resulted in over 6,000 visits here at this campus in the dental hygiene program. That is a complete dental hygiene cleaning that you would be lucky to find elsewhere, very thorough, and it's all for $20. $20 will get your entire mouth clean. Our vision care clinic is another important aspect of our program and campus. So our opticianry program, which is a 2-year program, also sees and welcomes patients from the community. Last year we saw in excess of 700 individuals through our doors. So we have a full functioning optical where we have discounted eye frames, discounted lenses, and you can also receive vision care screenings for as low as $20.
That's fantastic. I was going to go to the health fair, but I also want to talk about Health Connections before we go. There's a new program here at this campus Tell us about Health Connections.
Yeah, so Health Connections is a great program that just got off the ground. We just recorded our first segment, and very important for us and also the community. And thanks to your office and your team, we were able to partner with Larkin Hospital, Baptist Hospital, Jackson Health System as well will be taking part in this particular project. But it's all about health literacy and providing important information to the community at large. It's very important that our community out there becomes more self-reliant on themselves, participating in self-care, but they need the knowledge. They need to be made aware of the risks associated with various behaviors. They need to know what's available as far as resources in the community. So Health Connections is going to get them connected to these services.
Excellent. I'm looking forward. We have about 30 seconds left. Tell us about the upcoming health fair in February, the date,
Absolutely.
and where folks can go.
I'm going to defer a little bit to Carlene Webb.
Great.
She's part of the planning committee with IAC and Medical Campus.
Absolutely.
Well, the health fair is going to be at IAC, which is the Inter-American campus. It'll be February 25th from 9 to 1, and we have a whole variety of screenings available. Dental, vision, blood pressure, glucose, you name it, we'll have it. And also we have a lot of stuff for the kids. So middle school and elementary age kids, we have a lot of educational programs, little seminars there for the kids. It's going to be a lovely, lovely day.
Excellent. Can't wait. Thanks so much, Carlene, for joining us. Dr. Everett, like always, a pleasure.
Thank you, sir.
Hope to be back very soon. And to our
appreciate it.
viewers, thanks for spending the last 30 minutes with us. A very interesting show. And look for more right here on MDC-TV. I'm your host, Juan Mendieta. Until next time, good day.